Start.
Yeah, Nikhil, you may start now.
So, insightful webinar. We are honored to have such a distinguished gathering of medical professionals here today. Before we start today's discussion, let me allow me to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver superior and innovative care. Hetero Healthcare have established 300 products in the portfolio and are pioneers in quality and innovation. We have also launched four biosimilar products within the period of 5 years in the market and have a strong global presence in over 125 countries. Topic of today's webinar is enzymatic preparations with Papain advantage in dentistry. So to shed the light, we are privileged to have Dr. Satish Kumar Menon with us. Welcome, sir. Dr. Satish Kumar Menon is MDS in periodontics with 10 plus years of experience. He is the founder of Kaizen Dental and practices exclusively in periodontology and implant dentistry in Navi Mumbai. He has also published various papers in the field of periodentistry. He has a YouTube channel with 54,000 subscribers and Instagram page with 19,000 followers. BDS Launchpad and Dental Launchpad are the books which are written by him. So let me welcome Dr. Menon once again to this session. Dr. Menon, you can please start the session. Thank you, sir.
Thank you. Thank you for those kind words. It's amazing. Always I tend to wonder what makes us doctors. We work in the mornings, we work in the evenings, and still take out time to come here and listen to lectures. We go to lectures on Sundays, afternoons between patients. Whenever we are between patients, if we have time, we will go through a YouTube video or something of procedures. What is this desire? It is not dependent upon whether you are young, a dentist, or you're an old dentist. I've seen this across every dentist always. Why do we want this? Some would say we keep on learning so that we can treat more number of patients. Whereas others say we want to improve ourselves to a level where we can earn more. For others, being proficient in their work so that they have the satisfaction when they go back home that they are delivering the best to their patients. So, whatever we think all this circle is about, whether you want more patients, whether you want more money, whether your aim is to have more satisfaction and respect, it all boils down to having more patients and seeing that your patients are happy. If your patients are happy, you get that satisfaction and respect. If your patients are happy, they are willing to pay you more. If your patients are happy, they refer you more patients. And this positive cycle continues. So the bottom line is we are learning and improving ourselves to get more happier patients. But have you sat and wondered what do our patients actually want? You might have patients of different age groups and profiles. The old uncle with no teeth walking into your practice. The young corporate lady walking in your practice, juggling between work, house, and her job and children. Or the child who's scared, nudging onto the parent's arm and walking into your practice. What do each one of these patients want? When we discuss among dentists casually, we joke. Most of my patients want discounts. Some of them want good treatment. But do you think this actually applies or is true? You know of practices in your area who are charging less, but they do not have any patients. They're just sitting like that. And there are practices who are charging a bomb and still their waiting area is always packed. Good treatment? Yes. We want our root canals to be perfect. We want it to be 0.5 mm short of apex. We want the latest gadget so that we can do it. Have you seen root canals which are 5 mm short, patient has no pain? And you have done an amazing root canal 0.5 mm short and the patient has pain the next day. Which patient is more satisfied? The one with a short obturation or the one who's got a perfect root canal but has pain? So, what we desire from our treatments and what our patients desire usually is not the same. Our patients basically want three things. One is function. Remember the old uncle who walks into your practice? his main aim might be, I just want to chew. I need to be able to grind and eat the food properly. The corporate lady who might walk in, she might want an aesthetic smile, a pleasing smile. She wants more self confidence by getting a smile better. And the third and the most important thing, which a lot of patients want, is less or no discomfort. So, when a patient walks into a practice, these are the three main priorities in their mind: function, aesthetics, and less or no discomfort. After all this, it should suit their budget. So, in today's topic, we are going to talk about how do we make some of our treatments less discomforting or with absolutely no discomfort. One method which we have been using since ages for this is prescribing medicines. What is that? A regular, common painkiller, or the NSAIDs, which we prescribe left, right, and center to any patient who walks in before or after treatment. Why do we need to give these painkillers? How does this happen? Why are those reactions? Why is this swelling out there? Why is this redness? It all boils down to inflammation. Now, what is inflammation? It is basically a body's reaction to anything which traumatizes it. It might be a chemical injury, it might be a physical injury, it might be a burn, it might be a virus, bacteria, anything of that sorts. It is a body's protective mechanism. Now, why we see these things? What are the major symptoms of this inflammation? It's basically heat, redness, swelling, pain, and at times loss of function. In dentistry, as such, we do not see a lot of loss of function unless the swelling leads to some amount of TMJ issues where the patient cannot open his mouth. Other than that, it mainly involves swelling, redness, and pain. These are the three main discomforts our patients tend to have. Now, is inflammation actually bad? No, in majority cases it is not. It is the body's first line of defense. So when you're injuring a site, what do you want? You want a clot formation. You want that area to seal. You want to throw out the debris. So the blood moves into that area, cleans up or washes out the debris which are trying to enter. The swelling basically tries to keep all the infected part into that protected site and not letting it into the rest of the body. What happens with the pain? It's basically a body reaction to the various chemicals we create. These are various mediators which help us understand there is inflammation going out there so that we start taking care of that particular site. So, yes, controlled inflammation is actually a positive body response. But what happens when it drags over a period of time? Continuous irritation, continuous injury, continuous inflammation can lead to chronic inflammation, which is associated with various diseases from cardiovascular, neurovascular, and even cancer. Now, why should we be concerned about this entire inflammatory process? It's because whenever we treat patients, the main concern is pain, swelling, and irritation in that particular area. So, how does this inflammation happen? Imagine you're walking by the roadside and suddenly there is an accident which happens. So, the initial people out there are the primary observers of the accident which happened. Rest of the people who are passing by see the accident and start parking their cars or stopping out there. Some would go and call the police so that the police comes here and takes control of the situation. Others would go and call the ambulance to clear up and help the people who are injured. Whereas there'll be just certain bystanders who just stand there and do nothing and just crowd up the area. Similarly, when there is inflammation, it's an external injury which traumatizes the body. And there are plasma derivatives which are present out there, plasma cells which are present out there, which call the various plasma cells from the blood vessels. These blood vessels slightly open up, vasodilate, and get in more plasma cells into that particular area. So you have localized cell reaction as well as plasma cells which come into that area. Their main function is to clear up the debris, protect the site, and remove all the infection which happens out there. As a part of this, you end up having pain, swelling, and discomfort in that area. So these mediators who go and surround and take care of the area are divided into cell derived and plasma derived. Now these cell derived and plasma derived mediators have various sources from mast cells to leukocytes which produce them in that particular area. We are trying to understand all these parts of inflammation, but you'll be wondering, why does it matter to me? मुझे कैसे? Why am we as dentists studying pharmacology or pathology or physiology for that matter? You need to understand what kind of patients walk into your practice. Patients who might have trauma, patients who might have a missing tooth. You are drilling and placing an implant. Basically, what are you causing? Trauma or injury to the site. Or even a simple matter of giving a stitch or closing the site. What are you doing? You are causing trauma to the site. So we are dentists cause some amount of injury or trauma so that the patient does not have any long-term problems. This is called short-term pain for long-term gain. So when we cause all these injuries, or the patient comes with a swelling or a pain or discomfort of its own, or we have extracted a tooth, or we have done a surgery, the main fear a patient always has is two. One is during the procedure, by giving anesthesia or anything of those sorts, will I have pain? And post procedure, will I have pain and discomfort? So during procedure, it basically boils down to how good you are at giving anesthesia and the type of anesthetic agents you're using and how quick your procedure is. Where it matters is how you take care of the case once the procedure is done. So there are various studies done over years, and patients have always told their fear is of the pain and swelling what happens after the procedure. So for knowing this, we need to understand the various phases of healing. First, you have a blood clot formation. That's the hemostasis. That's where we tell the patient for the next 24 to 48 hours, you're not supposed to spit. You're not supposed to rinse. You're not supposed to use a straw. Why are these instructions given? Because the clot helps in the initial wound healing or formation of that. Next is the second stage where the actual inflammatory process starts, where we discuss the signs of pain, swelling, and other discomforts. That happens at the inflammatory phase. Once the patient moves into the proliferative phase of 2 weeks or 3 weeks and the remodeling of the gums and the bones, patient does not have major symptoms. It just happens in the background, like a background noise. So our concern as dentists to make it comfortable for our patients is to control inflammation. Have you heard those patients say, मैं वो dentist के पास गया था. I went to the dentist and they treated me. I had so much pain after the procedure. I am not going back there. And you have had patients who say, the treatment was smooth. After the procedure also I didn't feel anything. I am surely going back to the dentist. In which group do you want to fall? You want to fall in the group where the patients are satisfied not just during treatment, but even post-treatment, they are absolutely satisfied with you. And to help you in today's day and age, there are novel model approaches. The novel model approaches include a combination therapy of not just NSAIDs, but giving other enzymatic agents which can help heal the patient faster. This is where the game changer medicine known as Tolib comes into play. Now, Tolib has basically trypsin, bromelain, glutathione, and papain. The best thing is it comes from Etro Healthcare, which has a wide range of these biosimilar medicines. They are not just helping India, they are also exporting to 120 plus countries. This shows that their medicines have a good backing and good research behind them. But before we prescribe anything, our job as a dentist and a doctor is to know whether each and every component actually is useful. Should I give trypsin? Does it make a difference? Should I give bromelain? Should I give glutathione? What does papain do? Are these advantages to my patients or I'm just adding prescription to it? So for that, let us just go through a brief of each of these enzymes. Trypsin is the most simple enzyme. I'm sure you would have heard it during your digestive system. It's an enzyme which is formed in the has trypsinogen. It is released by the pancreas through the pancreatic duct into the duodenum, where it is converted into trypsin. Now, when there was research done, On this trypsin, it was seen that it inhibits vascular permeability. Remember when I told you about that site where there's an injury and a lot of plasma cell enters that site, leading to swelling? Similarly, trypsin prevents that vascular permeability. It helps stitch that area so that the swelling decreases. Second, it prevents pro-inflammatory cytokines, that is tumor necrosis factor alpha, interleukin 1. What does it do? These mediators go and tell other plasma cells, there's a pain or injury out here, please come, increase the swelling, let's come near more. So what it does is it prevents those mediators from acting. Next, it acts in fibrinolysis. What is fibrinolysis? Once you do repair of an area, you need to clean up that space. Imagine there is a broken wall in your clinic. What do? You call the carpenters, they clean it up, they cement it up, everything is done. You need someone to take all the mess out. Similarly, trypsin, once the healing is done, once all the fibrinolysis is done, the sealing of the area is done, you need to get that debris cleared out. That is what trypsin does out there. It has already been proven that trypsin works when you give it in burn patients because there's a lot of debris and necrotic tissue which is formed. So when you're prescribing a drug, you need to know whether this drug was given before, has it been advantageous? And the answer for trypsin is yes. Our medical MBBS colleagues have been prescribing it in cases like necrotic ulcers, diabetic cellulitis, rheumatoid arthritis, and even in ocular diseases. So it's a drug which we know is effective in inflammation and has been prescribed regularly by our medical colleagues. Forget trypsin. Let's move on to the next drug, bromelain. What is this? It's basically derived from pineapple. That's basically a natural thing which is available. How does it affect us in inflammation? If you see, it has multiple actions. It just not reduces the level of prostaglandins. It also inhibits bradykinin. These are again your mediators. Other than these mediators, it also acts in interleukin 1 beta, tumor necrosis factor alpha. And the most important thing, it prevents platelet aggregation. So when you have an initial injury, you want the clot formation there. You want platelets to seal. But after 24, 48 hours, you want that to be cleared out. You don't want just platelets coming out there and piling up and leading to an excessive swelling. So bromelain helps prevent that excessive clot formation or excessive swelling which might happen out there. Similar to trypsin, we need to understand, is bromelain being prescribed before? Is it an effective medicine? And as always, the answer is yes. It has already been used in sports injuries. There are certain studies which even state that if you give bromelain before a surgery, it helps in healing faster post surgery. So it is a drug again which has been tried and tested. The next is rutoside. Now, rutoside is found in buckwheat, tea, and apple. So we know again this is a naturally occurring enzyme. Now, how does it act in your inflammatory cases? It inhibits platelet aggregation, decreases vascular permeability, increases vascular flow. Basically, if there is a swelling out there, once the blood cleans up the area, you want that blood to move across from the arterial supply into the venous supply. That is what rutoside does. It strengthens the capillaries so that there is less blood oozing out and causing further swelling and reducing the edema of the area as well. Then comes whether there are free radicals which are causing irritation and other trauma to the site. It helps suppress them. And similar to the previous two enzymes, it also acts on the chemical mediators. The question we asked twice before, we are asking it again. Is this enzyme useful and been used before? The answer for this is yes, it has been used in cases of arthritis and in other inflammatory diseases, and it has shown to reduce oxidative stress in a wound area. And the most important game changer enzyme, which is not seen in any other enzyme which we prescribe in dentistry, is papain. Now, papain is a easy to know enzyme, but a tough to obtain. Basically, what they do is these raw pineapples, the ones which are green in color, there are incisions or cuts given on them. The latex which drains out from them is taken out, and then from that, the papain is derived. Now, what does this papain do? It strengthens the blood vessels, similar to rutacide. It has an anti-inflammatory action by reducing mediators like histamine and prostaglandin. It reduces and it has an antioxidant property by helping faster and cleaner healing of that site. It neutralizes the free radicals. And similar to rutacide, it improves microcirculation so that whatever debris is collected, it is easily cleaned out from the site. Now, has papain been used before? Yes, it has been used in sports surgery, sports injuries, diabetic ulcers, leg ulcers, pressure ulcers, even in burns. There are enough studies showing that papain is useful. So the only drug which has papain in India, enzyme, which can be prescribed in dental this is Tolib. So is there any study done with a combination of all these four things? And the answer is yes. Our very own Savita Dental College in Tamil Nadu has done a study. What they did is they found 60 patients who required a disimpaction surgery. 30 patients they gave our regular antibiotic painkillers. In 30 of them, they gave Tolib as an additional medicine or an enzyme. They found that in the group which was given Tolib, there was better healing, that is faster healing, reduced swelling, and the patient said they had lesser pain. So this was done based on a visual analog scale. So the analgesic effect was also better and the swelling was less. And remember what we discussed in the start. As dentists, what do we want? Why are we going through all this grind? At the bottom line is we want happy patients. And what do our happy patients want? They want less pain and discomfort. And this is already proven in a study done in India itself. So why are we waiting for? Why are we not trying to use such a good combination which is available? So overall, what does the entire synergistic effect of Dolip does? Number one, it decreases capillary permeability. Second, it decreases inflammatory response. Third, it prevents fibrin deposits stacking up over a period of time. Remember the fibrinolysis activity I told you about? Fourth, it improves blood circulation. It increases the healing and repair, strengthens the capillary walls, and it also is said to be equally effective to an NSAID and shows antioxidant effect. Now, you know the advantages, but when do we give it in a dental setup? In any disimpaction or a third molar or a surgical case, regular extractions if you feel the patient is going to have a swelling, any traumatic case, whether it's a swelling, a GBR, any case, if the patient has a disimpaction, a jaw fracture, wherever you are expecting swelling and you want faster wound healing and reduced swelling, this is an advantageous enzyme to be prescribed. Now, what is the dosage? It's said to be twice daily for as long as required. We know that majority of our healing phase or inflammatory phase happens between 5 to 7 days. That's where we prescribe our antibiotics and painkiller as well. So I would suggest, depending upon your case, twice daily, 5 days to 7 days. So if it's a major surgery, maybe 7 days. If it's a minor procedure, a disinfection or something of that sort, 5 days would also be good enough. Should we prescribe to the Tolib to each and every patient? Is there any discomfort the patient feels? Do you remember your pharmacology? What was the complication with every drug? Nausea, vomiting, diarrhea. These are the similar side effects which are found with bromelain and rutacide as well. But in bromelain, there is another thing which you need to keep in mind is if the patient is on warfarin therapy or for certain reasons, bromelain might affect that. So there are certain contraindications where Tolib should not be prescribed. One is if the patient is on warfarin therapy. Second, if the patient is already on certain sedative drugs, maybe for any other psychological reasons or any other reasons he's having them. Another place I wouldn't suggest using it is pregnancy and lactation. Not that it is unsafe. Thing is, we do not have enough research. So it is better to avoid in pregnancy lactation, patients who are on blood thinners like warfarin, and if the patient is taking any sedative drug. Other than these precautions, it is advisable to give it in all cases where you are expecting swelling, pain, and discomfort. So, what are we waiting for? Why are we not starting a drug, prescribing this enzyme to our patients, which is coming from a company which has a background of coming up with innovative products and helping us dentists help our patients further? So, if you want your patients to have less discomfort, better healing, I think it's time you start with toilet. With that, I would like to end my session. If there are any questions, I would like to take them.
Participating doctors, if you have any question, you can type in the question in the message box, that box. It will directly reach to Dr. Satish Kumar. Doctors, if you have any questions, you can type in the chat box. If there are no questions, so thank you, Dr. Satish, for this knowledgeable, insightful session, helping us understand Tolly in a better way. It's a pleasure to have you. Thank you for your time as well. Thank you, doctors, for joining in. Thank you so much.
Thank you, sir.
Right.